Pretty much anybody looking to improve the appearance of their sagging skin, of their cheeks and neck. Usually in the late 40s, early 50s, sometimes younger, sometimes older, and with realistic expectations and goals from the outcomes of their procedure. It really depends on the market you're in and the types of techniques you're looking for, but on average, a facelift should be somewhere around $15,000 to $20,000. It can be more depending on the market or the technique and experience of the surgeon you're looking for, or it could be less with less experienced surgeons and techniques that aren't quite as good as a deep plane facelift technique. Surgeries usually last somewhere between 3 and 3.5 hours, depending on if it's a primary or a revision facelift. You can look 15 to 20 years younger from a facelift, depending on the skin quality you're working with. Skin that looks older beforehand is not going to change much afterwards, other than just lifting the tissues. But if you have good skin quality, you can make a neck look like it did when you were 20 years old and completely clean it up and take 15, 20 years off their stated age. I try to avoid operating on smokers as best as possible, just because their blood flow to the skin is not as good as a non-smoker. But I also do a deep plane facelift technique, which is the only technique that's thought of as safe in smokers because it leaves the blood supply attached to the skin for the most part. And then people who don't have realistic goals and expectations from the outcomes of their surgery. The immediate acute recovery period is about a week and a half. You come in the next day after surgery, you have your dressing taken off, and then you have your stitch lines that need to be cleaned. Your stitches are all out by day 9 or 10, and then you're on sort of autopilot at that point. But I do tell clients, don't have some major life event planned for at least a month, where you don't have to be camera ready, no college graduations, no weddings, no family reunions where you need to take real photographs. And then even in a month, you'll still have some swelling, and we're typically taking our before and after photos somewhere between 3 and 6 months. The results from a facelift are pretty instantaneous, even though there will be some bruising and swelling following surgery. You will see your neck and cheeks lifted quite significantly as soon as the dressings are off. And then, full healing occurs over a 1-year period. And even though we're taking our photos somewhere between 3 and 6 months by definition and technically, we do not judge the final result from a facelift until 1 year post-operatively. I routinely perform facelifts on people in their early 40s, but the youngest person I've ever performed a facelift on was 36 years old. We typically perform about 100 facelifts a year. It can be anywhere from 8 to 12 a month, and the holidays and summer are always busier than other times of year just because people have the time off of life and work to recover. We have a modified or an extended deep plane facelift that we perform here. We call it the Kalos lift. The deep plane facelift is sort of like the Ferrari and Bentley of facelift techniques. It has nothing to do with the skin incision at all. And it can be performed through a mini facelift incision, but it gets you the most natural looking long-term outcome from the procedure, and particularly lifting the upper cheeks and the neck better than even the traditional deep plane facelift.